Hello everyone, my name is Dr. Priyanka Saokar Navale. I am owner of World Class Dental Clinic which is located in Pune, FC Road. So today I am going to talk about dental fillings. So what are the basic types of dental fillings? Most of the patient they ask us this question, what are different types of filling, okay, and which filling you are going to do in my case. So there are multiple type of dental filling. First one is a silver filling. You must have seen it previously, like it is slightly old dentistry will say, because nowadays we don't use amalgam that frequently or the silver filling. So it is blackish in color, slightly grayish in color, and it mostly contains the mercury along with some other metals. So there are few studies they stated that the mercury vapor can affect the health of individuals, and there are multiple studies done whether the amalgam fillings are good for you or not. But nowadays dentists avoid using amalgam filling because of the two basic reasons. First reason is aesthetic purpose. Since they are black in color, most of the patient don't prefer them because it looks black. Second thing, there are chances of secondary caries more with the amalgam, as there will be some gap between the filling and the tooth surface, and the saliva and bacteria can go inside and cause secondary caries below the amalgam filling. That is the reason recently we are not, most of the dentists are not using it. Second filling comes the composite filling, that is the white color filling, where you must have seen some, we provide some light blue color light to cure that material, that is known as composite filling. It is tooth colored, and the way it bonds with the tooth is a mechanical bonding. Okay, so it's not a chemical bonding, or not like amalgam, there is no bond at all, but it is the mechanical bonding. Okay, so the composite filling is most commonly used filling because it just looks like your tooth. Why? Because there are multiple shades are available. Whatever the color of tooth you are having, like there are multiple shades, we can choose that particular shade for your dental filling. So composite filling is most widely used. Third filling is ZOE, that is zinc oxide eugenol. It is a filling mostly we do after the root canal treatment, just to test whether the root canal is done perfectly or not, and rather we are supposed to replace that zinc oxide eugenol filling with the permanent filling, that is composite or the amalgam, if in case few dentists are using it. Okay, so what is ZOE? Zinc oxide eugenol filling usually doesn't have any type of strength, very minimum strength when we compare with the amalgam filling or the composite filling, very minimal strength, because we have to remove it easily, and we are keeping inside it, the mouth only for I will say 8 days or 10 days, depend on the RCT program, sometimes for 2 days or 1 day also. So that is third type of filling. And the fourth is GIC, that is glass ionomer cement. So glass ionomer cement is mostly used in case of we use it most of the time for kids. So it actually bonds with the tooth surface in chemical bonding. So chemical bonding occurs between the filling material and the tooth surface, and it bonds properly. So most of the time GIC is used in case of kids, and even we use in few adult cases where there are very deep caries are involved. We are giving some type of medicament, that is calcium hydroxide, and above that most of the time we place GIC, that is glass ionomer cement. Later sometimes we replace partly with the composite, that is known as sandwich technique. So most of the cases we do it for adults where they have very deep cavities. So this is all about filling. Hope you must have got some rough idea what are the dental filling, what different materials are used, and how they bond with the teeth. Thanks for watching guys. Bye bye, take care.